In the healthcare debate in America, there are those who love the Affordable Care Act, which still has not been repealed, even though we have had Republicans in control for a number of years now. There are those who love that, or at least provisions of that, and then there are the others who claim to love our existing system because they say that it represents a free market economy. The truth is, our existing healthcare system is anything but free market. It's much more socialized in many ways than a true free market healthcare economy would be. And that's a problem. The problem is that healthcare costs in America have been rising faster than inflation for many decades, with the end nowhere in sight. It's so expensive to go to the ER, to have a doctor visit, to get surgery, and it doesn't need to be that way. There are some reforms that we could enact which would make a big difference. During World War II, President Roosevelt, FDR, was very cognizant of the need to have a united front here in the United States, and he wanted all industry to support the war effort in Europe and then in Japan. And to do that, among other things, he imposed an executive order that froze salaries. He said employers cannot give pay raises, at least during the time of the war. So American employers, with their ingenuity, wanting to reward their hard workers, barred by this federal edict from giving them pay increases, decided instead to start paying for their health care. They offered benefits. This is the first time that this happened, and a few employers did it, and it took off until by the end of the war it was pretty much nationwide, or at least among the bigger employers. And after the war was over, it was so popular that it continued, and people started getting their health care coverage through their employers. It was very cheap back then in the 1940s and early 50s. And over time, somebody went to Congress and said, we should be getting a tax break, we employers. We're doing this for our employees. We should get a benefit. And Congress agreed and codified that tax break. So now, any employer that provides healthcare coverage for employees can write off those expenses as part of their cost of doing goods, or cost of doing business, cost of goods sold. And individuals who accrue their own healthcare costs, who are self-employed, let's say, they can't write off their cost of healthcare. So there's a total tax incentive for us to get our healthcare coverage through our employers, which makes zero sense. And it has evolved into the system that we have now with co-pays and deductibles and networks, in-network, out-of-network, all that kind of stuff. Imagine if you had to buy your milk or your shoes or your toothpaste that way. Have you met your copay? What's your annual deductible? And so on. It would be ridiculous. It removes the element of competition. It removes consumers who are trying to decide what is best worth their while. Instead, it leaves it to insurance companies. So the tax law needs to be changed. And there are other reforms that I would love to champion that would make healthcare a true free market. We need medical tort reform, where people can't have crazy lawsuits against medical malpractice issues for millions and millions of dollars. We need to set a cap on that. And we also need to have maybe an amendment to the Constitution that would prohibit states from imposing or requiring licensing and credentialing certifications for people who practice medicine, for medical schools. In short, there are lots of things we could do that we're not doing now that are very market-oriented beyond just medical savings accounts, which could take the cost of healthcare way lower. And I support those things.